These medicines can save lives, but only if you understand how they work and their possible side effects. So welcome to Mental Health and Science with Brother Enoch Francis. Today I want to teach you about the side effect of mental health drugs because one day the parent was about to fight with the doctor because he prescribed the medication for his son, which reacted so badly that even the doctor was not able to handle. So in our today's lesson, I want to break each and everything so that you can be able to support your family out there. You can be able to know that these are some of the side effects. So number one is that mental drugs can cause what we call sedation. Okay, they can make you to sleep. Maybe you feel like you wake up, you find you are sleeping, and sometimes they increase your appetite. Like you find a patient is overeating food. That may be if he's on other types of medication that we call antipsychotics. So we have different types of medication. One of them is there's a group what we call antipsychotic medication. Those are medicine that we give to people who are talking uncoordinated things, who are behaving abnormally. Like you find someone is hearing voices of other people are not hearing. Someone is seeing things which other people are not able to see. So those are called antipsychotics. So as I teach in this lesson, in case you have this side effect, I am not saying that you change your medication, but I'm saying that you see the health worker so that you explain to him or her, then he can be able to what? To change. So another side effect that we can get is that we can get what we call tremors. Tremors is that you find the fingers are shaking, okay? And sometimes you can have what we call this, you find the finger is moving. Like you find the patient is seated, but maybe one of the fingers is moving, but most of them are what? Are moving. So all these side effects, we group them under what we call extrapyramidal side effect. In that, when you look at this hands, these fingers, our feet or the mouth, those are called extremes. So this side effect happen at those points. So that's why we call them extrapyramidal what? Side effects. So you can find when the fingers are moving, okay, you can find someone is very stiff, like he's pushing a wheelbarrow, okay. You can find someone, the tongue is out. You can find the drooling saliva just flowing. Or you can find someone is just looking, like eyes are looking in one side. Those are side effects of what? Of medication. Then also we can also have, if it is a man, you may find that there is also they affect the sexual desire. They can reduce the sexual desire, or they affect your libido. Like you want like interact with your wife as a husband and wife, but you find that the man is not performing the way supposed to perform as he's supposed to do. So in case you get such kind of a side effect, then you have to talk to your doctor. Then he can change to another type which does not affect you as a man. There is also dizziness. Okay, there are some medicines that you take and you feel you get dizziness. Then also there are others when you take, you feel restless. You find someone is walking from one corner, goes to another corner. That is called akathisia or restlessness. So they can cause you to be moving from one point to another. So that is under a group of medicines that we call antipsychotics. But take note of this, that if you are a clinician, if you are a doctor who is listening to me right there, out there, is that whenever you prescribe someone antipsychotic medicine, there is other medicine that you have to prescribe to take away those side effects. Okay? So we have medicines that control the side effect, and if these side effects are not controlled, sometimes they can become what? Permanent. For example, if someone is moving like this and you don't give medicine very well to control the side effect, you may find that that person will remain like that. Or if you leave the man with this kind of side effect, they can be permanent, and you find that even when he's sitting in public, his fingers are what? Are moving. But these are side effects which are controlled, and if you are someone who is dispensing medicine, you need to explain to this person so that they can know the side effect of this medication. Because when you just rush, say one time was one, you start morning, evening, this, you have to explain to the clients. You have to explain to the patient, then they can know. But if you're a community member, you're a parent, you have someone who has this kind of mental problem and is on those drugs, please watch out for this side effect. That in case they are there, you give the medicine that takes away the side what? The side effect. Then also we have medicine for people with depression. They have different classes, but there's one which causes sleep. You oversleep a lot, and also can also reduce your sexual desire. And in case you experience this, also we tell you that talk to your doctor. Sometimes they can cause dryness of the lips. You find your lips are always dry. Then others can also take away your sleep, like if you swallow at night. If they say you to swallow in the morning and you swallow at night, they can take away what? Your sleep. Under anticonvulsants, or the medicine that we give for people with epilepsy, there are some medications that are contraindicated. This time I'm going to mention it because I don't want the health workers to mess up with this one. The medicine called sodium valproate. Okay, it is contraindicated in people with reproductive age, in that if you give to people, any female of reproductive age, they can make those people to produce children with congenital abnormalities. So we are saying that don't initiate medicine like sodium valproate on what? On women of reproductive age, because we don't want them to produce children with congenital what? Abnormalities. Okay. Then also we have another medicine. It is called carbamazepine. Sometimes people can react to it differently. Like it can cause this skin to change black. Some people can react to it. It is called Stevens-Johnson syndrome. Okay. So if in case you are initiated on this medicine and you get that kind of side effect, please talk to your doctor. He can change to another anticonvulsant. If you are new to this channel, I request you to subscribe, like, comment, because it motivates me to make more videos of this nature. So then also we have other different classes of medication. For example, if you have anxiety, we find that we shall give you some other medicine which also can make you either to sleep or to rest. So this side effect can be serious, but we are telling you this because we want you to know about your condition. Okay. And in most cases, if you are a LSA worker or if you are someone who is working at a dispensary, we are saying that every medicine that you give a patient or even a doctor, you are supposed to explain to them the side effects that they expect from that medication. Okay. During the COVID-19 vaccination, is that people reacted differently to the vaccines, and there are those who got serious fever, there are those who got headache, and but if you had explained to some of these people, they will find it not they will find it easier for them to know and identify the side effect and how to manage them. So thank you so much for listening to this video and watching. If you are new to this channel, I request you to subscribe and like, comment, and let us share this knowledge. Thank you so much, and let us promote mental health together. Let me see you in my next video.